Welcome to This Explainer. Today, we're unraveling a genuine medical mystery, one that connects a devastating, widespread condition to, honestly, a completely surprising biological suspect. We're diving deep into the science of endometriosis, the complex bacteria living right now in our gut, and a landmark clinical investigation known as the METROFERT trial.
Let's start right off the bat with the sheer scale of this issue, because the human stakes here are absolutely immense. 1 in 10 reproductive-age women globally suffer from endometriosis. 1 in 10. It's a deeply painful condition where endometrial-like tissue grows outside the uterus, causing chronic, severe inflammation. But you know what's crazy? Despite being that overwhelmingly common, it remains heavily underfunded and understudied, especially when you compare it to male-dominant conditions.
And the economic and personal burden? It's just staggering. The U.S. alone spends approximately $69.4 billion annually on endometriosis care. That is a massive number. And finding an effective treatment is tough. Right now, hormonal treatments fail in over 30% of advanced cases. And while fertility-sparing surgery can provide incredible relief for many, there's a really frustrating catch. Anywhere from 20% to 37.5% of individuals still experience persistent pain after going under the knife. So researchers desperately needed a new lead.
Which brings us to Section 1, the microbiome clue, a new suspect.
Enter the microbiome. Now, you might just think of this as gut bugs, but it's actually a highly complex organ system made up of bacteria, yeast, parasites, and viruses that literally outnumber our own human cells. Modern sequencing has revealed this to be a true biological cosmos inside us. In fact, it's estimated that 99% of the genes in our bodies, that's over 10 million genes, are microbial, and they are absolutely integral to human health.
Well, within this microbial cosmos is something incredibly specific to our endometriosis mystery, the estrobolome. Basically, this is a collection of genes in the gut microbiome that produce estrogen-metabolizing enzymes. What they do is, they can actually reabsorb estrogen from your gastrointestinal tract right back into your bloodstream. Since endometriosis is completely driven by estrogen, recent evidence suggests that an altered microbiome, specifically this estrobolome, might actually be driving the inflammation and pain of the disease by manipulating both your immune and nervous systems.
So researchers obviously looked at preclinical models to see if altering this microbiome could help, and the initial clue they found was massive. In animal studies, administering an antibiotic called Metronidazole, which specifically targets anaerobic bacteria, actually decreased inflammatory markers and shrank the size of endometriosis lesions. I mean, it worked incredibly well in the lab.
Okay, let's dive into this. The preclinical data was incredibly promising, right? But as we all know, mice aren't humans. So the burning question for doctors became, can a targeted antibiotic like metronidazole actually reduce endometriosis pain persistence in humans following their fertility-sparing surgery?
That leads us straight into Section 2, the METROFERT trial, a clinical investigation. Here is exactly how they set the trial up to answer that question. Step 1. Participants aged 18 to 50 underwent fertility-sparing endometriosis excision surgery. Step 2, right after visual confirmation of the disease in the operating room, they were randomized. Step 3, they were given either 14 days of oral metronidazole or a placebo capsule. And finally, Step 4, they were all evaluated at a 6-week follow-up to closely measure their pain persistence.
Looking at the patient randomization in this flow diagram, you can really see just how rigorously this was conducted. Out of 152 people assessed, 88 were randomized. Factoring in a few who were lost to follow-up, the final cohort landed at 72 participants. But what's really vital to note here is that the baseline demographics, the starting pain levels, and the disease stages between the placebo group and the antibiotic group were incredibly similar. It was, essentially, a perfectly balanced scientific test.
So let's look at Section 3, the surprising results, data revealed.
And this brilliantly illustrates the core findings. Looking at the summary straight from the study, the conclusion is absolutely unmistakable. Administering a 14-day regimen of oral metronidazole right after fertility-preserving surgery did not, I repeat, did not, result in any significant reduction in pain persistence at the 6-week mark compared to the placebo.
Now, what's really interesting about this slide is the visual breakdown of this null result. When looking at binary pain persistence at those 6 weeks, the placebo group sat at 12%, while the metronidazole group actually sat slightly higher at 16%. Now, that slight increase isn't statistically significant, but it firmly shuts the door on the idea that the antibiotic provided an added pain relief benefit over just taking a placebo. Furthermore, the researchers looked at secondary outcomes just to make sure they weren't missing anything subtle. They tracked quality of life using EHP5 scores and sexual function using FSFI scores. And once again, there were absolutely no significant differences between the placebo and metronidazole groups. The drugs simply didn't provide any measurable advantage across the board.
But wait, there is a massively important silver lining for patients here. Over 80% of all participants in the trial saw huge improvements in their overall pain. This is incredibly encouraging because it proves that the fertility-sparing excision surgery itself worked extremely well for the vast majority of patients, even if the antibiotic didn't give them that extra bonus effect.
So, you're probably wondering, why didn't the metronidazole work like it did in the mice? Well, researchers noted some fascinating limitations to consider. First off, the antibiotic was only given for 14 days. It turns out immune regulation by the gut microbiota might create a microenvironment of inflammatory cells that actually have memory, meaning they might just be entirely resistant to such a short course of a single antibiotic. 14 days just might not have been long enough to permanently alter that internal landscape.
Which brings us to our final part, Section 4, What Comes Next? Future Interventions.
You know, in science, a null result is never a failure. It is an essential redirect. It tells us exactly where we shouldn't look so we can focus our energy on where we should. And this study points to some thrilling future interventions. Instead of just dropping an antibiotic bomb to wipe out bacteria, researchers suggest we might need a much more complementary approach. We're talking about the deliberate reseeding of the gut through dietary changes, prebiotics, and probiotics. And looking even further ahead, there are advanced concepts like bacteriophage technology and microbiome gene therapy. The goal here is to carefully reshape and heal the environment, not just sterilize it.
Which leaves us with a truly fascinating question to end on. If 99% of our genes are microbial, what other secrets does the microbiome cosmos hold for women's health? The METROFERT trial may have closed one door regarding a specific 14-day antibiotic, but it has blown wide open a whole new frontier of scientific discovery. Thanks so much for joining me on this explainer, and keep questioning the science around you.